Alright guys, this is the fifth and final lection of the medical terminology portion of this course. Today we're going to talk about medical specialists and case reports. So the learning objectives for this chapter are to be able to describe the training process of physicians, which I'm not really going to go over in the lecture as much, but you will be able to read up on in the text. What we're really going to touch upon is identifying medical specialists and describe their specialists or specialties, identifying combining forms used in terms that describes specialists, and decipher medical terminology as written in case reports, which you'll work on throughout your study guides. So some residency programs, all right? Anesthesiology. Anesthesiology is the administration of agents capable about bringing sensation loss. So if you've ever been put to sleep before you had your wisdom teeth removed, or you had a big surgery and you were sedated, okay, that was done by an anesthesiologist. Dermatology, they diagnose and they treat skin disorders. Emergency medicine is the care of patients that requires a sudden and immediate action. So like EMTs, they are the ones on the sidelines, or show up at accidents. Then a family practice is they deal with the primary care of all members of the family on a continuing basis from pediatrics all the way to geriatrics, and they handle everything. Internal medicine is the diagnosis and treatment of usually complex non-surgical disorders in adults. Ophthalmology is the diagnosis and treatment of eye disorders. So if you go see an ophthalmologist to get glasses. Pathology is the diagnosis and cause and nature of disease. Pediatrics, I talked about that a little bit, is the diagnosis and treatment of children's disorders. So pediatrics really specialize in children. Psychiatry is a diagnosis and treatment of disorders of the mind. Radiology, diagnosis using x-ray studies. And surgery is treatment by manual, which surge means hand or operative methods. So here's some more specialists. An allergist, they will deal with hypersensitivity reactions. So if you're allergic to milk or wheat or grass or bees or whatever you're allergic to, that was detected by an allergist. Cardiologists, they treat heart disorders or diseases. A geriatrician treats diseases of old age. And an oncologist diagnoses and treats malignant and benign tumors. They are the ones that diagnose and deal with cancer. A pathologist, they diagnose disease by analysis of cells. Radiation oncologists, they treat diseases, tumors, or cancer with high energy radiation, and urologist treats and performs surgery on the urinary tract of and male reproductive system. So let's get into some combining forms that are appropriate for this chapter. We have cardi, which we know means heart. Colo means colon or large intestine. Dermat means skin. We've seen that one before. Endocrine, we've talked about, means endocrine glands. Entero is intestines. Anesthesio, anesthesiologist, deals with sensation. Okay. Gastro is your stomach. Ger is old age. Geriatrician, we talked about that one a little bit. Gyneco is woman or female. Gynecologist. Hemat is another term for blood. Iatro, okay, is the treatment of. Geriatrician, okay, they treat old age. Larynx is your voice box, okay, your larynx. Lymph means lymph. Nephro is another term for kidney, and neuro is nerve. We've heard those ones before. Nos is disease, like diagnostic testing. Obstetrics or obstetric is midwife. They are most generally, when you see a gynecologist, they may be an OBGYN, an obstetric gynecologist, where they deal with babies as well. Odonto is teeth. If you go to an orthodontist, okay, they deal with straightening your teeth or tooth. Onco is another term for tumor, and ophthalm is eye, as we talked about earlier with an ophthalmologist. Opt is another term for eye, and optic is another term for eye. Ortho is straight. So if you go to the orthodontist, you're getting straight teeth. Ot or OTO is ear, and patho is disease. Pedo is a child. Okay, pediatric deals with children. Psych is your mind. Psychiatrist. You got the pulmonologist. They'll deal with the lungs. So pulmon means lungs. Radio is X-ray. And recto is your rectum. Rheumat deals with the flow or fluid. Okay. If you have rheumatoid arthritis, that has to do with this. Rhino is your nose. So if you have a rhinoplasty, you got a nose job. Thorax is your chest cavity. Uro is your urinary tract, and vascule is your blood vessels. So we're just going to go over a couple terms that you might see in the specialties. So if you're working in a cardiology clinic, you'll see the terms angina, which is chest pain. You'll have anticoagulants, diuretics, hypertension, which is its abbreviation is HTN. You'll see that a ton, which is just high blood heart rate or high blood pressure. Sorry. Ischemia and antiarrhythmic. If you're working at a gynecology clinic, you'll see words like dysmenorrhea or hysterectomy or leiomyomas, menorrhagia, sonograms, or fibroids. If you're working in orthopedics, which deal with your bones, okay, they're going to deal with your callus, femur, fibula, which are both bones, fixation, fractures, those types of things. If you'll deal with radiology, which is your x-ray views, you'll have to do with anterior, infiltrate, lateral, medial spinal, posterior. So these are just a couple terms that you'll see, guys. So you really want to focus on the trade and the specialty that you're looking to get into. If you really like the heart and you want to do more with cardiology, educate yourself, guys. Take the time to look further into what terms you might see every day, so that when you land this job outside of this program, you're more than capable and ready and willing and knowledgeable in terms of medical terminology. That's it, guys. That's all of the medical terminology for this course. Take your time, work through it, keep up with your Quizlets, and always, always, always go back and refresh yourself. I know this is just the beginning of the course, but this is a key feature because we're going to be using medical terminology all the way throughout. Continue with your studies, have fun, and enjoy this section.